Hi, happy Saturday. It is like a beautiful fall Saturday. I love it so much. It's raining. I love the sound of the rain. So it's like, oh my God. So someone asked me why I seem to have a problem when I swallow. And I do. Well, I don't know what it is, but I had breast cancer. I know I've said that before. And some things it left, the treatment left me with. And swallowing is one of those things. So it's like, I can't really explain it. But yeah, it left me with something like that and neuropathy. So, however, I rarely have the neuropathy problems like I did like that first year. I noticed when I began to really massage like those areas where the lymph nodes were removed, um, like massage the areas. However, since I'm on the story, it is September, and September of 2019 was when I had an OBGYN appointment. Um, and I had the night before the appointment, I had a dream. And in that dream, I remember seeing myself. I was lying on the bed, and it was like it was um, the bed, the doctor's office bed, and someone was touching the spot, and they were like, "You have something there." So I was like, "You need to get that checked out." So I woke up. It was 3:33. Angel numbers, what? So I got up and I touched that spot, and I was like, oh shit, there is something there. It was like maybe about this size. Yeah, maybe about this size. I could move it with two hands. I mean, two fingers, but then I could actually put three fingers on it. It was like, yeah, maybe about this size, you know. And I was like, okay. It was under my armpit, not by my breast, but like basically like right under my armpit, but like close to my breast. Well, you can't see me now. I'm wearing this sweatshirt that my sister cousin bought me during the time of my treatment, and I would use it for my tears because on it said, like, it says, I feel weak, but I know I'm strong. And I'd be like, because that was like a moment my divorce had just finalized, and I felt alone. I felt like I was afraid. I was terrified. I wanted my mom. I wanted my aunt. I wanted all the women that I loved around me. I was afraid for my kids because I was just like, oh my God, what if I die? What's going to happen to my babies? Um, how is this going to affect them since their dad wasn't living with us and our relationship was rocky? Um, how is this going to affect me mentally, if it is something? Basically, but make a long story short, no, I'm not going to make a long story short because the process needs to be heard, right? So I went to the doctor the next day. I told them about the spot, and she was like, well, it doesn't feel like much. It feels like a swollen lymph node. And I was like, I was thinking that, but I remember it being smaller than this like 3 years ago because I remember massaging that spot because I don't know, some reason like this side, I breastfed my kids, and this side, for some reason, didn't produce that much milk, but my left side did. And I remember rubbing under my arms because I saw that you need to massage your lymph nodes or whatever. And I remember it being like very small, pretty tiny. I could just roll one finger over it, but I hadn't really touched it since then. I would do the breast exams or whatever, but not thoroughly. And then I went to the doctor. She sent me to have a mammogram. And mind you, I'm 42 now, so I was 30 something. Oh, 39. What? So I did that, and a couple of weeks later, well, yeah, a couple, like they sent me for this appointment and this appointment, and then I had to have a biopsy, and I was terrified. I was just like, okay, and I was doing everything by myself. I talked to a few people. I talked to my aunt, and she told me, well, don't worry until you have something to worry about. And I was like, okay, like I understood that, but I'm like, that doesn't stop you from worrying, because as a mom, as a human being, we worry about the unknown. And I was worried, I was scared, and like I said on my previous video, for that, um, thinking about my children, I was terrified, because my thought process was, I love my kids in a different way than what I've seen around me, and I'm afraid for someone else to raise them or nurture them, because they're very traditional in their thinking process, and my will has something in it, that says, where my kids are going and blah blah blah. And although that was years ago and I've changed my will since then, I was just like, is this person mentally, emotionally, physically, like especially emotionally equipped to handle kids that has lost their parent or whatever. Basically, I had painted an entire picture of what's going to happen to me. And then I was like, you know what? I don't even know whether I have cancer or not. So I went to my appointments, got my biopsy, and then it was like right during the time where COVID was tricky, it was a little scary. So they kept putting off certain appointments. Then I would have to go to this, do this blood work, this, that. So basically, December, I found out I had cancer in October. I'm like, go figure, breast cancer month. So I found out I had cancer October of 2019, the end of October. Oh no, November, because I found out that my dad also had cancer. So it was like, what? Why didn't you tell me? I found out that my dad had cancer, and I was just like, oh my God. And the way he told me, it was like deja vu. Like I already had heard it before. And he told me that he was sick, and that he had been sick for a while, and I was like, so is it like the antacids, because he had been taking antacids for years. Um, but let's go on. He told me what was going on in him. I told him that I also was diagnosed with breast cancer, and then I had to find out the stage after, I think, some procedure they did. So I found I had stage 2 breast cancer, and then it was like boom boom boom, appointment. February of 2020, I had a lymphotomy, a lumpectomy, and which is where they take out the lump. I did not have to remove the entire breast, and I had, I think, like 20 something lymph nodes removed from under my arm, which caused nerve issues, and it, yeah, nerve issues. And then I thought I was doing the right thing by not really moving the arm, and because it was sore, I was scared and this and that. So I started my chemo treatment the day everybody shut down for COVID, March 13th. That was my first day of treatment. I had to drive myself. I was terrified. I didn't know what to expect. I was by myself, and it originally, like, what was told wasn't really happening, and that was okay, because I needed it to work out the way it did. But in those moments, it started teaching me who actually, you have to do this alone, and you're not alone, because you're going to see that you're not alone. So I drove myself, and I was there for 6 hours, or was it 5? I don't know, 5 or 6 hours. And that was like, it was like I can taste the chemicals going in my body. I was terrified. I walked into that room. I was just like, oh my God. I was shivering, shaking, looking around. And it was like, okay, I got to do this. And my kids were at school. And I knew that I had to pick up my kids from school. It was just like, how are you going to do this? It's going to work out. So I had a friend of mine, DO, I would call and be like, hey, is it okay if you blah, blah, blah? Because, I mean, when I say this is like my motivator, he's a fitness instructor. So he's like one of those people, you got this. It's all good. You got this. I know it sounds hard, it's tough, but you're going to make it through it. That's how he would lift me up. And basically, he gave me me. He gave me what I needed. And I needed that strength. I needed that motivation. Because some people I would talk to would be like, how is it? Like, what's going on? And it's like, I couldn't take for that type of talk that kept me in the process. I needed someone to talk to me that lift me up out of it. Like, let me feel liberated within like what was going on, because it was, the foundation already seemed rocky. So I needed to feel like you're gonna make it. Everything's gonna be all right. I know it's scary, but you're gonna make it. You know, and like I basically had to cut somebody off. Like, yo, man, dang, my cousin just died from that. Like, no, that's not what I want to hear. I appreciate this conversation, but I can see you're not emotionally or mentally equipped to help me in this moment. This is not helpful. I, I'm gonna give this back to you. I'm sorry, but I can't talk. And I saw that's how some people were, you know. And some people like, why did I have to find out you had cancer on Facebook? And it's like, well, we haven't talked in 2-3 years. What am I gonna? Oh man, I got breast cancer. No, I need to. You show me, like certain things. I had to make sure that I followed my gut. Follow my gut. And I talked to uplifters, and that was like the best for me in those moments. Um, so I started my treatment. I drove myself home. I talked to my aunt, and she was asking me how I was doing. Like, I told her, I said, I don't know whether I want to go to sleep or lay down, lay down, go to sleep, or run. I said, I feel like I want to throw up, but I can't, because they give you like it's like Zofran, but I remember the smell and the taste. It's this medicine that keep you from throwing up or being nauseated. Basically, keep it from making you like so nauseous. Plus, they already had given me medication to take when I got home to keep that down. That shit don't work, but whatever. I think it was like 13 medicines I was getting during those times. I'm not sure. I can't remember, and it's for a good reason. However, the came home. I was like, okay, I made it. It was like, oh my God, oh so draining. I had bought some strawberries, and because they tell you, you might want to bring something, but you eat something light, nothing that has a smell. And I now to this day, like, too many smells still make me sick. you know. So like I was talking to a lady who was like, well, this was a long time ago. Then shouldn't you be over it? I don't know. I, I want to say I don't know. You tell me. I don't. No, it doesn't work like that. You don't know how it's going to affect your body. For me, chocolate, I still have a problem eating. It tastes like blood, and I am or was. I still am because I'm like, oh my God, I want it so bad. If I used to love hot brownies, now I cannot eat a hot brownie. It's like I cannot. Um, it's raining and my incense is getting wet. I don't want it to get wet. It smells so nice, pleasant, peaceful, and so I I was preparing for. I was like, oh, okay, treatment went okay. I made it through. I lost a lot in like a day. Looking at myself, I didn't really know what to say to people because they were asking me how was I. I didn't know. My kids still had to go to school. I still had to get up early in the morning. Make sure they were ready, cook, clean. It was just like thinking about it now. I remember how the feeling. So in those during that time, it's like I don't know. I couldn't really tell people how I felt because I honestly could not put it in words. I had never felt that way before. But I know fear was the biggest emotion that I can name. It was just like I was just scared. I'm like, what is this? I'm like, dang, this is creepy. So I um prior to that, my dad had his surgery in January, and he kind of told me what to expect. Like, not what to expect because we had different surgeries, but he kind of told me like, you're gonna have your surgery, they're gonna remove it, and listen to your gut, and know that I love you. And he would always like kind of prepare me for it prior to. He had his treatment in February. I mean, yeah, in February. He had surgery in January, treatment in February, and he was like telling me how it make you feel, and um, how it for him it bothered his throat as well, but he also had esophageal cancer, basically stomach cancer, and I thought that just because it bothered his throat was because of how his surgery was with his everything. Um, so it was awesome to have that person that I can talk to that actually had experienced it, who could understand, who understood people trying to help and you don't really know what you need help with, you know. So only difference was I was getting this shot. Like I would have my treatment on a Friday and get the shot on a Monday, and the shot was supposed to produce red blood cells, and they were gonna put the like this patch on my arm where it will automatically just like inject into me 48 hours or 24 hours after, but I don't think my insurance will cover it, which was fine because yeah, it worked out like it did as it should have. So after the shot, you have to wait 15 to 20 minutes, and immediately I could feel my bones hurt. It was like a pain I can't describe. Like I could, like my body would just shake in so much pain. And how do you hide that amount of pain from your children? You cannot. So I would tell them, Mommy's in pain. Naomi, let me show you how to make such and such. If we needed groceries, I would, if my ex could or whatever, I would either call, what was that? Not Uber Eats, but I forgot because at that time the Kroger delivery didn't do that. They didn't deliver, but they would pack your groceries up and have it ready for you to pick up. So I started doing that because at first I would let the girls make a list because I couldn't eat what I wanted. I would just like want things, but it's like once I get it, the smell, the taste, like certain things burn my mouth. Fruit was like what I could eat, no problem. I love salads, but my teeth hurt, so I couldn't really crunch on like yeah, I couldn't. It did not work. Even thinking about it, I'm just like, you know. And so I would do things like that, and it was something. It was some days I could not swallow. I had like mouth sores where I could not close my mouth. So eating fruit helped. Cold fruit, like I would say grapes, but I don't think I could eat grapes because they would burn my mouth. I love strawberries. I could not really eat strawberries because they would burn my mouth. It was like anything that was acidic would burn my mouth so bad. So for those, well, actually, it's like your body goes through a cycle. So you have the first week it happens, you're going through the pain, the vomiting, the really lethargic. It's like you're here, but you're not here. But you have to push through it. My baby still had homework. They still had their own thing, and they were scared. They were so afraid of what was happening to their mom. They had never seen me the way I was. I was literally crawling on the floor from the the pain in my back that causes the red blood cells to produce. And then I was afraid because I would get a fever, and they tell you if your fever makes it to 100.4 or 100.3, then you need to go to the emergency room. So of course it's like I'm trying to keep my fever down. I'm cold, I'm hot, I'm cold, I'm hot, I'm freezing, I'm burning up. It's like so I'm trying to listen to things that motivate me. Certain calls I could not take. Just producing everything within myself that causes me to think differently. So this what pushed me to become how I am now. How I began to tell my girls, like, look, this is what's going on with mommy. Mommy is scared, but I need your help. I need you to let me know what you need. My baby girl went through like a depression because she said, I'm scared that you're not gonna make it, basically. And I got it. So I fought because cancer is most definitely the fight of your life. I met some awesome ladies at the during treatment. They would talk to me, we would talk, and that's where it was like a collaboration of feelings and men too. So it was men there too, and just talking and watching their fight. Mothers who had just had babies had breast cancer, and it's like, or cancer, and it's like, you know, be grateful. And I'm telling myself, okay, be grateful because your children are old enough to talk and express themselves, and it may be difficult, however, teach them how to handle it. So talking to them and actually making them talk back. Laying on the couch or lying on the couch watching my oldest play a video game gave me such joy. It was like, oh my God, although she was talking on the phone to her friend, or she'll just be playing the game and she'll ask me, is it okay? Can you come watch me or something? My baby girl loved to read, so she would just lay on the couch and read next to me. She didn't have to read out loud because she knew I was going to be asleep, and I slept a lot. But I still got up. I drove them where they needed to go, practice, whatever. I was still on it. Everything shut down, so that means we were always in the house. So that means more meals being cooked, more groceries need to be gotten, and it's like, okay, how do I handle this? How do I handle this? And it's a lot, because just because you call someone and ask for advice, if they've never experienced it, they don't know how to handle it. And some people just want to hear what you're going through because they're attracted to your strength. And I didn't need anyone attracted to my strength. And I didn't realize that until now, that that's what the attraction was. I needed someone that will give me some of their strength, that will motivate me to know that, hey, everything's going to be okay. You know, come talk to me, tell me how you feel, so you can get it out of your head. And I had some people that would call and be like, hey, Tay, talk to me. He's like, how are you? Okay. Send me a picture. I need to see your face. And I'll send, nah, you look like that's a fake smile. Call me. Like, they'll call me and talk to me. Man, that was the biggest blessing. one of my friends' mom had breast cancer before, and she would, I mean, she poured into me like, I know this is gonna be hard. However, you got this. God, God got your back. Just believe that everything is okay. You have to believe it and begin to feel it, and that's what I started to listen. And but the more treatments you have, the harder it is. So that third week, I'm thinking my hair is all good. Oh, and I woke up, there was hair all over my pillow. I was trying to figure out, my scalp was so sore. It was like, what the buzz? And luckily, I had gotten my hair cut down to here because they told me that I needed chemo. So I had prepared for it, but I had no idea what it was going to be like. I mean, literally, I did this and the whole patch just came off. Because I was like, why is this on my pillow? Because it looked like little speckles. So, yeah, it was like the hair was sitting on my head like a hat. So I was like, okay, I just got to take it off. And I couldn't take it off like that because that hurts. So if you're going through treatment or you're about to go through treatment, just go ahead and cut it off. I I didn't care about what I look like. I noticed like some people asking me like, "Girl, you you're not gonna put anything over it?" Yeah, I put a scarf over it because my scalp was so tender. It was red, and it was just, I can't even explain. It was like a whole map on my scalp. like it was just fiery red. Like, yeah, sore to the touch, like could barely touch it. But my aunt sent me some oil. I forgot the name of the oil, but it worked. It was like it was okay. So I would like massage it into my scalp. I was like, oh my god, this feels so good, and it actually worked with my skin too, because my skin became really not dry, but it didn't feel like my skin. It felt like something else. It was like it was yellow. So I was afraid that my liver was jacking up. So I would ask them, how's my liver? Like, what is my liver? And they were like, your liver's good, Miss Durante. I'm like, okay, I just want to check because I feel like I'm turning a little yellow. But she's like, I think that's your natural color. I'm thinking, maybe it is, but it's a little more yellow today now than it was before. But I just, it was great having. I wouldn't say having breast cancer was the best thing that happened to me, but it most definitely wasn't the worst. You know, having breast cancer taught me about my own inner strength. It taught me to monitor my fears, and one of my biggest things was, okay, you need to do it. Like, I would be talking and I would have to get off the phone. I remember calling my cousin, and luckily my aunt was next to her. But well, I call her my aunt, but she's actually my cousin too. But I'd be like, ugh, I don't know what's wrong with me. I feel so, like, I was so weak. I mean, crawling on the floor, and I had been drinking like crap. It was like an Ensure, but the Ensure made me sick, and this one was like lactose free, and it did not make me sick. If I put it in the freezer, it had ice in it, I could drink it and I felt better. And then I can get up and maybe make some rice with some brown rice with some like chicken broth, you know, or something like that. Or I'll make my daughter something else. And my baby girl didn't really like meat, so whatever I made for her, I had to, it was like, ugh, the joys of parenthood. However, I wouldn't say that, breast cancer most definitely taught me to check in with myself. So, I'm reading the books. I had to stop reading the book that said breast cancer care, and I actually just threw it away like a few weeks ago. Like, nope, because it had too many memories in it. Anything that carries too many memories for me, it's best, like, too many memories that bring me down. Because I remember reading that book, and it's like so much fear, because it tells you, oh, okay, well, if you have stage this, it's going to look like this, and if you have stage this, it's going to look like that. This is what it's going to look like during radiation. This is what it could look like after your lymphotomy. Yeah, I mean, lumpectomy. Lymphotomy, what the hell? After your, oh, well, I guess I did have a lymphotomy. It's taking away lymph nodes. But so, yeah, this is what it could look like. If you have stage 2, blah, blah, blah. If it has a milky this, it's like, so many ifs. you know, and my surgeon, oh my God, Dr. Polinomi, she was like straight to the point, caring but firm. I loved it. I needed that. I could ask her anything, she'll answer, and tell me, I'm not making any promises, but this is what it looks like, and blah blah blah. You know you're gonna be okay. I'm gonna give you a minute to talk about like how she didn't rush me to make decisions, and she understood that making those decisions could be tough. So it was great. I had to stop and look at the time because I was like, I know my girls got to go to work by 10. So, you know, I think we go through things, and monitoring how we feel and making sure that one thing that my nurse told me, she said, if you have anything around you that stresses you out, you need to get rid of it. Because if you don't, she said, I've seen a lot of people not make it because they're so stressed out. They're already sick and stressed out. So during like things that you got going on in your life, you have to monitor your stressors, monitor them, and monitor your mind. So what I would ask myself, sometimes I would go in the restroom and make a bath, and I'm like, okay, my lymph nodes, I was so swollen by like the 4th treatment. I'm just like, I could feel myself panicking, and I'm like, what's wrong with me? Like, I'm okay. And I'm like, you know what? I'm afraid. Why am I afraid? You know, I'm afraid because what if I don't make it? You know, it's usually a what if negative. And I'm like, well, sorry, excuse me. Tea is most definitely not hot anymore. Oh gosh. But it's still just a little bit delicious, I guess. It's soothing. Um, um, well, it quenched my thirst. How about that? So I would ask myself, like, what am I feeling? Why are you afraid? And at first I would say the superficial thing. Well, I don't know, or this is too much, or like, I'm afraid of the unknown. I would start to get down to actually the actual cause of my fear. I don't know what's going to happen. You know, so when I talked to my dad, he would tell me, you can't control everything, Shantae. I love that man. And it's okay that you're afraid, and it's good to talk about it. And that's natural. It's okay to be afraid. He was like, I'm afraid sometimes too. And he said, you know, you really learn who's there for you and who truly understands. You really learn your own strength. And he said, just watch funny things. So I would watch things that made me laugh. I would do things that made me laugh. My kids and I played more. And I figured out, like, I love people. I need to show them. So I showed everybody I talked to how, oh my God, you know, I let them know how beautiful they looked and how glad I was that we connected, and I became more appreciative for the people I came in contact with. It's all the things that I needed to build myself up. I displayed it. All the things I thought I needed from an outside source, I became it. And I began to see myself like, and before the end, most deaf, it was hard. I mean, radiation is no easy joke. 30 days, 30 rounds, that's 30 days, and it's not easy. It feels like you've been sitting in the sun, like that 10, 15 minutes of being in there, and you feel like you're exhausted. I drove myself home to every appointment, and that was difficult. That was difficult. I mean, some days I was so tired. I just like get home and it's like I'm just drained. I knew my girls gonna, they needed stuff. They needed to eat, things like that. So I could not show up. I had to show up. I had to give them what they needed. You know, I had to basically push Naomi, hey, go take care of your sister. Go look after your sister. Mommy needs a nap. Like, and she's like, okay. And I noticed that she was afraid. She was so scared. She was so scared. And she later on told me why she was scared. It's because what if you die? My sister and I have different dads. Although my ex took care of her, and that's his baby. Like he never treated her like anything less, or yeah, whatever. But that was her thought process. Would I be fully accepted? And that wasn't like, for a child, she needs that reassurance. It wasn't clear to her, like, what's going to happen to me if something happens to mommy. So then I noticed my kids begin to separate because of like other things. So you notice the things that's going on around you, and this is not just about being sick. This is about like everyday life. Notice your kids. Like, remember what it's like, because the same thoughts we have, we need reassurance. Kids have them too, and that goes along with how to build healthy relationships with their kids. Open and remember the same shit I went through. I could see it in them. I could see it. I'm asking, what is wrong? What's going on? Tell me what's on your mind. And she's like, nothing. I remember saying that, this, like, that tells me like they're disgusted by something, or like it tells me they're frustrated and they scared to let it out. So I remember myself doing those same things. Therefore, I could see myself in them, which made me relatable. And I showed them how relatable. I gave them examples of, oh yeah, I remember making that same face when I was younger. Especially when I was living with somebody. I didn't know what was going on, or I was confused. I was thinking about what's going to happen to me. Yeah. So I let them know. I became more friendly and less preachy. I became a human being instead of a Christian. I just became me. But the more questions that are sent to me, the more answers I will give. And remember, this is nothing said like this is how you have to be. No, I'm not saying that. So please don't come to me with that bullshit. What I am saying is this is what I did to connect with my children, because I noticed this is what I needed as a child. I needed the adults to connect with what was going on in my head, because what I said on the outside was not what I was thinking. It was, and most adults know that because they do the same shit. So, yeah. But yes, please keep sending me questions, and I will most definitely keep answering. I love you guys. And if anyone out there is going through treatment or anything, make sure you listen to things that are funny. Give yourself the love that you need, and be open and honest about how you feel. Like, my friend Derek connected me. I read something about having a massage, and I began to there was someone that would come and give me a lymphatic massage because I weighed almost 200 pounds. I went from 140 to like 201, and I was told that I was gonna that I if I didn't get the weight off, I would have a heart attack, which I could feel like something was going on. I was sick. I couldn't move. I couldn't walk actually, so I wasn't able to walk for a while. And Naomi and Natalie would help me walk, and I would be like limping. It's funny now because I was like I could barely move. It hurt so bad because like like pins and needles basically. So I was like walking down the street. My aunt would be looking at me from the window, and walking down the street trying to, and I couldn't walk far, but I would test myself in the morning. I would walk from here, from the driveway to the mailbox, and it would take me like 30 to 40 minutes. Oh gosh. And then in the middle of the day, sometimes it was too hot, but I would push myself to walk a little further, and then I would push myself to walk a little further, and then I would push myself to walk a little further. Sometimes I had to walk by myself, and then I'll have to call somebody. Can you pick me up because I can't walk back home? So just know what you need. Hey, 470-830-8458. Yeah, one mind at a time. So if you need someone, if you're in the Atlanta area and you need someone to walk with you, I got you. If you need someone to talk to you and lift you up, I got you. If you need someone to like just vent to, what's going on, how do you feel like? Because I'm gonna ask you questions also, so be ready. But getting out how you feel without blaming anyone else, how you feel, because sometimes how we feel on the inside is because of what we're seeing, based on if we're afraid, and if we're afraid, sometimes we're blinded by fear. You can't really hear that help is actually being offered to you, and help was being offered to me sometimes, but it was like, I'm like, I don't know, I couldn't really trust it. And sometimes I was just like, yes, like I had to let down the pride, because I did not like asking for help, and knowing that everything's gonna be okay. E-money. That's what my friend called me. E-money. Everything was gonna be okay. And just know there are people out here that will help you. I'm a phone call away. So if you need that help, you need that voice, you need someone to just, I'm big on hugs, and I'm always like this in those moments where I feel like I need a hug, and I need it. I know that inner child in me needs a hug. Then I'm big on this, and trust me, during your treatment, you need a lot of hugs. A lot. So just know that a phone call away, one mind at a time, 470-830-8458. Much love.